Dr. William Mercer.
There's a moment, maybe 7 days before, maybe less, when your body already knows something your mind hasn't caught up to yet. It doesn't scream, it whispers, and almost everyone who survives a heart attack says some version of the same thing afterward. Looking back, I think my body was trying to tell me. If you're over 55, what I'm about to walk you through might be some of the most useful information you hear all year. Not because it's designed to scare you, because it's designed to prepare you. Here's why these signals get missed almost every single time. They don't look like heart problems. They look like being tired, a stiff shoulder, a restless night. Things everyone brushes off as just getting older. That disguise is exactly what makes them dangerous, and exactly why I want to walk you through them today. By the end of this video, I'll walk you through the one sign that even cardiologists say gets overlooked more than any other, the one that rarely comes up at a routine checkup, because on its own, it doesn't look like it belongs to your heart at all. Stay with me until the end, because that single sign might matter more than everything else in this video combined. Quickly, who am I, and why should you listen to me on this? I'm Dr. William Mercer. I've spent years working with patients on heart health, reviewing cardiovascular research, and, if I'm honest, watching too many people arrive after the fact, when catching this a week earlier could have changed everything. I'm not selling you a supplement, a program, or a course. Nothing. My only goal with this channel is to take real research most people never see and turn it into something you can actually use. Let's get into it. Here's the short version of what's happening inside your body. And I promise, just 2 terms. Your heart is fed by blood vessels called coronary arteries. Over years, they can slowly narrow with buildup. Picture a garden hose getting kinked bit by bit. Water still flows until it doesn't. When your heart muscle gets less oxygen than it needs, that's called ischemia. Remember that word. It's the root cause behind almost everything I'm about to describe. The second concept, referred pain. Your heart shares nerve pathways with your jaw, neck, and arms, like a crossed wire in a fuse box lighting up the wrong switch. So sometimes, distress from your heart doesn't show up in your chest at all. It shows up somewhere else entirely, ischemia, referred pain. Hold on to those, you'll see exactly why in a minute. Let's start with the sign almost everyone already has right now and doesn't think twice about. When your heart isn't getting quite enough oxygen, it can't pump quite as efficiently, and your whole body quietly shifts into energy-saving mode. Not unlike your phone dropping into low power mode long before the battery actually dies. Picture a woman, let's call her Diane, a scenario I've seen play out with real patients more times than I can count, mid-60s. Started needing an afternoon nap just to get through chores she used to breeze through. She figured it was just age catching up with her. It wasn't laziness. It wasn't normal aging. It was her heart quietly asking for less. Here's where most people make a mistake. They measure fatigue against how they feel, not against how they used to feel. That's the wrong comparison. New, disproportionate tiredness, especially over several days, is not something to explain away. Have you noticed anything like that in yourself or in someone you love in the last week or two? If you have, here's your one sentence to remember. Tiredness that doesn't match your day is not a character flaw, it's a message. Now here's where it gets a little more physical and a little harder to explain away. This is breathlessness that shows up doing things that never used to touch you. A single flight of stairs, carrying in groceries, making the bed. Your heart, straining to pump, can let blood back up into the vessels around your lungs. It's the engine losing compression feeling, still running, just working twice as hard for the same result. What most people do wrong here is blame it on being out of shape and try to push through it. But there's something even more important than fitness level to pay attention to. The change. Not whether you get breathless, whether it now takes far less to trigger it than it used to. One sentence to remember. If easy things suddenly feel hard to breathe through, that's not a fitness problem. That's information. And now, the one I promised you at the very start of this video, the sign most people and even some doctors don't immediately connect to the heart at all. Remember referred pain? This is it in real life. An ache, tightness, or discomfort in your jaw, neck, shoulder, or upper back, not your chest, because your brain is misreading exactly where the distress signal is coming from. This is especially common in women, and it's one of the biggest reasons heart attacks in women get missed or delayed. Everyone, patients included, is trained to look for chest pain first and everything else second. I think of a man I'll call Robert, early 70s, a dull ache in his jaw and left shoulder that came and went for about 5 days. He blamed a dental issue, maybe yard work. It was neither. Within the week, he needed emergency treatment, and that ache had been trying to tell him the entire time. Would you have ignored a symptom like that? Be honest with yourself for a second. Most people would have. That's exactly the problem. This is the part that surprises cardiologists most. This sign often shows up completely alone, with no chest pain at all, ever. One sentence to remember. An ache in the wrong place can be the right warning. Let's pause and lock in what we've covered so far, because the next 2 signs build directly on this. Sign 1. Fatigue that doesn't match your day, your heart quietly asking for less. Sign 2. Breathlessness that shows up too easily, your heart working harder for the same result. Sign 3. An ache in your jaw, neck, or shoulder, your heart's distress signal misfiled somewhere else. Individually, forgettable. Together they start telling a story. Keep that in mind, because it matters even more once we get to sign 5. Quick myth to clear up, because it changes how you'll hear the rest of this video. Myth. A heart attack always starts with sudden, crushing chest pain, the kind you see in movies. Fact. Many don't. Some people, especially women and older adults, never experience that classic chest pain at all, before or during. If you've been waiting for the big one as your signal to worry, you may be waiting for a symptom that never comes. Here's something I haven't told you yet. The next 2 signs are, in a lot of ways, more surprising than the first 3 because almost nobody connects them to their heart at all. This one hides in plain sight: nausea, a queasy stomach, or breaking into a cold sweat for no clear reason. Your body's fight-or-flight system, activated by a heart under strain, redirects blood away from digestion, like a building's emergency power system cutting electricity to non-essential floors to keep the critical ones running. What most people do wrong, they treat it as automatically digestive, a stomach bug, something they ate. But context is everything here. Nausea or cold sweats on their own mean very little. Nausea alongside fatigue or breathlessness or that jaw ache we just talked about, that combination is worth a same-day call to your doctor, not a wait and see. One sentence to remember: your stomach doesn't lie, but it does sometimes speak for your heart. Now the last one. And I want to be honest with you, out of everything in this video, this is the sign I think gets the most completely misunderstood, because almost no one thinks of it as a heart symptom at all. Trouble sleeping, paired with a vague, nagging unease that doesn't have a clear cause. Even mild reductions in how well your heart delivers oxygen can quietly disrupt the nervous system rhythms that regulate both sleep and your baseline sense of calm. Think of it like a smoke detector with a low battery. Not a full alarm, just a faint, irregular chirp. Easy to ignore, not something to ignore. On its own, poor sleep obviously has 100 causes that have nothing to do with your heart, but paired with any of the other 4 signs from this video, that combination is exactly the pattern worth taking seriously. One sentence to remember: when your body won't let you rest, don't just treat the symptom. Ask what it's protecting you from. Here's what actually matters more than memorizing 5 separate signs: recognizing the pattern when it shows up together. New fatigue on its own might be a rough week. New fatigue plus breathlessness plus an unexplained ache? That's not a rough week. That's your body sending the exact signal we've spent this whole video decoding. Isolated symptoms are noise. Two or more together in the same week is signal. That distinction is the single most useful thing you can take from today. Before you go, I want you to picture one specific person. Maybe it's your husband who's been complaining his shoulder just won't loosen up. Maybe it's your mother, brushing off her tiredness as just her age. Maybe it's a friend who joked about being out of shape lately. Send them this video, not for the channel, because it might be the exact thing that gets them to call their doctor a week earlier than they otherwise would have, and that week could be the entire difference. Before you go, which of these 5 signs surprised you the most? Just drop the number 1 through 5 in the comments. I read every single one. One last thing, and I say this at the end of every video, everything you just heard is for educational purposes. It's not a diagnosis, and it's not a substitute for a conversation with your own doctor who knows your history far better than any video ever could. If anything here resonated with you, bring it up with them directly. My goal with this channel will always be the same. Real research, translated into something you can actually use to protect your health and the people you love. You don't need to panic over every ache or every tired afternoon. You just need to stop ignoring the pattern when it shows up. If your body is whispering to you this week, please, listen. That's the whole message. Take care of yourself, and I'll see you in the next one.